Good afternoon, learners. I am Mrs. Farino by name, and I'm one of the nursing tutors at the nursing department at LODLC. And I'm one of the tutors that will be taking you NSC 208, which is General and Cellular Pathology, for this semester. So I want to welcome you for this semester. So we are two tutors that we have that will be taking this particular course. The name of the secondary tutor is Dr. Mrs. Ogumodede. So she will be the one to take you some study sections. Although when we are taking the study section, it might not be in succession. It might not be that, okay, I'm going from 1 to 2 to 3. So we will take this study section as time permits us. So I will be the one to kickstart this particular course. Then the name of the facilitator for this course is Dr. Nasir. So he will be the one that will be coming on the day of face-to-face facilitation. Although I will be present, but he's actually the one that will attend to the face-to-face facilitation. So I want you to watch this video. After I'm done with this lecture, I'm going to upload it on your LMS. So you are required to watch this particular video. Then any question you have as regards this particular study section, we are going to meet on the LMS chat so that we can have an interactive section. So I'll be able to clarify any question you have. Then at the end of each study section, I'm going to be uploading quiz for you to attend. And this quiz is very, very important. Very important for you to attend because it's going to form part of your continuous assessment. So it's going to be within a specific period of time and you have to attempt it. It is very, very compulsory because it's going to form part of your continuous assessment, and I pray God will help you this semester. So we are starting study section 1 today. So the course is General and Cellular Pathology. So the first topic is Introduction to Pathology and General Mechanism of Disease, which is study section 1. So the introduction. Pathology is a branch of medical science that is focused on the study and diagnosis of disease. So that is majorly pathology. All we do in pathology is that we are focusing on the study and diagnosis of disease. The word pathology refers to the study of disease in general, incorporating a wide range of biology research fields and medical practice. However, when used in the context of modern medical treatment, the term is often used in a narrower version to refer to processes and tests that falls within the contemporary medical field of general pathology, an area that includes a number of distinct but interrelated medical specialties that diagnose disease, mostly through analysis of tissue and human cell samples. So as a field of general inquiry and research, pathology addresses components of disease. It tells us about the components of disease, what are the causes, mechanism of development. It tells us about the pathogenesis. What are the structural alterations of cells and consequences of these changes, which means the clinical manifestation. So when we are talking about pathology, it will tell us about the components of disease, it will tell us about the cause of that particular disease, it will tell us about the things, the effects that this disease can have in the body, and what are the consequences, which are the clinical manifestations. So in common medical practice, general pathology is mostly concerned with analyzing known clinical abnormalities that are markers or precursors for both infectious and non-infectious diseases, and is conducted by experts in one of two major specialties, which are anatomical pathology and clinical pathology. Now let's talk about definition of pathology. So I'm going to be giving you these these two definitions. The first one is that it's a branch of medical science that is focused on study and diagnosis of disease. It is a branch of medical science. So pathology is a branch of medical science that focused on the study and diagnosis of disease. So the second one is that the term pathology is used when one refers to scientific study of disease. You can say, okay, it is the scientific study of disease or the alteration that occur when abnormal influences like maybe bacteria, viruses, fungi, when they come to affect our body, when they affect the cells, when they affect the tissues or the body system. So more specifically, pathology can be defined as the scientific study of molecular, cellular, tissue or organ system response to injurious agents or adverse influences. Now, I decided to put this diagram for you to be able to understand, because the pathology is broken down into different types. So for us not to be confused, I want us to take our time when we are watching this video to to actually study this diagram. So it will give us a perfect picture of what pathology is about different types that we have, because it is classified into different groups. So as for us not to be confused, that is why I decided to put this diagram. So pathology, you can see from the diagram that, okay, we have pathology as the heading. Now this pathology is divided into two. So don't get it confused. We have anatomical pathology and we have clinical. You can either say, okay, anatomic or anatomical, whichever one that suits you. So we can say we have anatomical pathology and we have clinical pathology. Now, for anatomical pathology, you can see that it is divided into three. We have the surgical pathology, we have the cytopathology, and we have the forensic pathology. While the clinical pathology is divided into three also. We have the hematopathology, immunopathology, and radiation pathology. As nurses, we practice in the ward, we nurse different types of patients, so we need this knowledge. So we have to know it. It is compulsory. So we need to get acquainted, get ourselves familiarize ourselves with this classification of pathology, because it is very important. We need it, whether we like it or not. So let's start with classification of pathology. Pathology is classified majorly into two, like you have seen in the previous slides. It is classified into clinical pathology, like I've said, and anatomical pathology. So let's start with clinical. What is clinical pathology? Clinical pathology involves the examination of surgically removed organs. Can we see? Surgically removed organ. When our patients go to theatre, maybe they do what's it called now? Total abdominal hysterectomy for a patient, or myomectomy. You know, sometimes we send them to the lab, we send them to the pathologist for us. Okay, we want to examine, we want to for those for that particular organ that has been removed. We want to send it to the pathologist to review it, to know if it is cancerous. So you want to know, so that you'll be able to know how to manage your patient further. So clinical pathology involves examination of surgically removed organs, tissues, bodily fluids, and in some cases even the whole body. I've been hearing of autopsy, autopsy, autopsy. So when we hear of this, it has to do with clinical pathology. So it's a medical specialty that is concerned with the diagnosis of disease based on laboratory analysis of bodily fluids like blood, it can be urine, tissues, and it can even be the whole body. So when we hear of clinical pathology, it does not mean, okay, it's only autopsy. Anything that is surgically removed from the body, and it can be even the body fluids, it can be blood, it can be urine. Now, anatomic pathology is a medical specialty that is concerned with diagnosis of disease based on the gross, microscopic, chemical, immunologic, and molecular examination of organs, tissues, and whole body. So anatomic pathology can be divided into surgical pathology, cytopathology, and forensic pathology. Like I've showed you in the previous two slides, I've put it in a diagram for you to be able to understand it perfectly. So don't get it confused. So anatomic pathology is divided into surgical pathology, cytopathology, and forensic pathology. Please take notes. In case if you are asked in your CBT exam that, okay, anatomic pathology is divided into how many? So you should be able to name them. You should be able to know that, okay, it is divided into three parts. It is divided into surgical pathology, cytopathology, and forensic pathology. Now let's talk about the subdivisions of clinical pathology. Like I said earlier, we have the hematopathology, immunopathology, and radiation pathology. And you should be able to know the meaning of these subdivisions. You should be able to know it. You should be able to define them. So from the word hematopathology, when you hear the word hema, you know that hema has to do with blood. Hemo, it has to do with blood. So as nurses, we know that when we hear the word hema, that has to do with blood. So hematopathology is related to the study of blood, or it has more to do with identifying blood diseases specifically than chemical pathology. So it's related to the study of blood, but it has to do with identifying blood diseases. Now, immunopathology is the study of immune system disorders. That is what this one deals with. It deals with what? immune system disorders. It deals with immune responses to foreign molecules, allergies, immunodeficiencies, and organ transplant rejections. So this is what happen. Take for instance when there is organ transplant rejection, as a result of immune system reaction, when a patient just receive like a new organ, the body will want to react because it is a foreign body. So the immune system of the body will start producing antigen antibodies just for this particular organ to be rejected. So immunopathology is the one that deals with this kind of organ transplant rejection. So it is immunopathology that deals with this. Then when we talk about radiation pathology, that one is the study of effects of radiation exposure on normal tissues, whether due to natural background, radiation, or a consequence of therapeutic, diagnostic, or accidental. Now, subdivisions of anatomical pathology. We have three major subdivisions like I've mentioned earlier. We have the surgical pathology, the cytopathology, and the forensic pathology. Now, what is surgical pathology? Surgical pathology is just the examination of tissues that was removed during surgery. A common example is examination of a small piece of tumor tissue to determine whether the tumor is malignant. I think I said this earlier. Like, okay, a patient has undergone myomectomy, you want to know, or a patient, maybe a particular tissue has been removed from the patient. You want to send this particular organ or this particular specimen, you want to send it, you want to label it and send it to pathologists for them to review it. You want to know if it is cancerous. You want to know if it is malignant or benign. If it is malignant, the management is definitely going to be different from if it's benign. So that is what this surgical pathology deals with. So it helps you to make a diagnosis, and this procedure is called a biopsy. Now for cytopathology, it's the study of small groups of cells. When you hear the word cyto, just know that it has to do with cells. So it's the study of small group of cells shared in bodily fluids or obtained through scraping, when you scrape, or such as those taken during a cervical pap smear. So you scrape these particular cells and you go to examine them. That is what is known as cytopathology. Then the last one is the forensic pathology. For forensic pathology, when we get the word forensic, it's just a branch of pathology concerned with determining the cause of death by examination of a cadaver. Take for instance, when you watch all these American movies, I don't know if you are used to them, maybe at a crime scene, and we know that they will start looking for all sort of evidences, or maybe like fingerprints. They will, okay, maybe somebody opened the door, maybe to commit a murder. They will start looking for, okay, all these evidences, the fingerprints of the person that has actually committed the murder, and they will take it they will take it for a particular study. So this is the word that we use, forensic pathology. So it's a branch of pathology that is concerned with determining the cause of death by examination of a cadaver. Then the autopsy is performed by the pathologist at the request of a coroner, usually during the investigation of criminal law cases or civil law cases in some jurisdictions. So forensic pathologists are also frequently asked to confirm the identity of a cadaver. Now, apart from this classification I've spoken about, we also have another type of classification that is known as molecular pathology, although it is not common. So the ones I discussed earlier are the most common. They are the most popular one that we do talk about. So we really talk about this molecular, but just for the sake of knowledge, we are here to learn, we still have to know it. So molecular pathology is just a relatively recent discipline. Like I've said, it is a recent discipline that has achieved remarkable progress over the past decade. So it emphasizes the study and diagnosis of disease through the examination of molecules within the organ. So they will just examine molecules within the body organs, the tissues, and the bodily fluids. So many diseases such as cancer are caused by what? They are caused by mutation. They are caused by alteration in the genetic code of a person. So when a person have cancer, you know that, okay, something has been wrong with the genetic code of that person. There has been an alteration. So many diseases such as cancer are caused by mutation and alteration in genetic code of a person. And identification of specific hallmark mutation allows clinicians to classify a disease and then choose the appropriate treatment. So it is this molecular pathology that actually help to detect any alteration in the genetic code of a person. So what it does is that it helps to identify the molecules, or it helps to examine molecules within the organs, within the tissues, and within the bodily fluid. Now, what are the units in pathology? We are going to talk about three major units. The first one is virology. We have virology, we have bacteriology, and we have parasitology. So these things are simple. They are the things that we know. We've learnt them at one point or the other, maybe in our school of nursing. We learnt them in our microbiology. So they are not difficult. So there are three main units in pathology. The first one is virology. From the word virology, we all know that, okay, this is virus. It's just the study of viruses. The submicroscopic parasitic particles of genetic material contained in a protein coat and virus-like agents. I think during first semester, we treated this, we treated bacteria, we treated virus, we treated fungi, all these causative agents, we treated them. So it's not supposed to be new to you. So it focuses on their structure, their classification, and evolution. You know, we treated virus in detail, we treated bacteria, fungi, we treated them in detail, even drew their diagram, their mode of nutrition, everything, we treated it during the last semester. So it focused on their structure, their classification, their evolution, the ways they infect and exploit host cells for reproduction, their interaction with hosts, organism physiology, and immunity. So the disease they cause and the techniques to isolate and culture them, and they are used in research and therapy because they are also very useful. Although they are they are causative agents, they are disease causative organisms, but they are also useful in their own way. Now the second one is bacteriology. Bacteriology is just the study of what? Bacteria. Two major important elements that control the interaction between bacteria and human are the defenses or immunity employed by the human host and the virulence factors exhibited by the bacteria that enable them to produce infection. So bacteriology is just the study of bacteria. It's as simple as that. It is the study of bacteria. Then the last one is parasitology. What is parasitology? Parasitology is just like, okay, the study of parasites and their hosts, and even the relationship between them. When we hear the word parasites, we know that, okay, from the word parasites feeds on their host. They depend on their host for survival. Parasites cannot live on their own. From the word, when we hear parasites, sometimes we make jest of ourselves. Okay, we say, okay, somebody is a parasite. All they know how to do is to depend on people, is to feed from people, is to collect from people. So that is the exact word. Parasite feeds on their host. They cause more harm to their host. Most of the time, host doesn't benefit from the parasites. So parasitology is the study of parasites, their hosts, and the relationship between them. Now let's quickly move on to disease. What is disease? What is disease? We all know that, okay, disease is any harmful deviation from normal structural or functional state of an organism. When our body deviates from the normal physiological process and it starts malfunctioning, then, oh, a disease process is actually going on. So it's generally associated with certain signs and symptoms and differing in nature from physical injury. Now, what are the basic mechanism of diseases? What are the basic mechanism? We have genetic. When we hear the word genetic, gene, these are basic mechanism of diseases. It might be that, okay, there has been an alteration in the gene. When there is an alteration in the gene, even if a gene has been mutated, then definitely there will be problem. Then when we talk about pathogenic, all these causing organism, bacteria, viruses, they are one of the factors that contribute to disease. Then we have the tumor and cancer. We have tumor and cancer. We know that, oh, when there is a tumor, when the tumor is in situ, when there is a cancerous growth, we know that, oh, definitely there's a disease process going on. Then physical and chemical agents, all these toxic substances, weather, anything around, pollution, talk of anything. They are part of the things that, that causes disease. Then malnutrition, the kind of food that we eat also determines it also contributes to disease process. If you are malnourished, the body will not be able to fight infection. The immunity will be dropped. The immunity will be low. Our body needs good food. We need good nutrition to actually build, our body needs good nutrition to actually build our immunity so that we can fight all these what? All these causative, all these disease causing organism. We need a strong immunity to fight disease. So malnutrition are one of the things that contribute to diseases. And another thing is autoimmunity. Autoimmunity. Sometimes the immune system will start working against themselves. Then we have inflammation. Inflammation is actually a good thing. When something happens in the body, when there is an injury, definitely what will happen? There will be inflammatory reaction. But sometimes when they occur at the wrong time, or when this inflammatory process are just too often, then it leads to what? Disease process. Then another thing is degeneration. Well, I would like to say, okay, degeneration maybe as we age, as we grow old, our body begins to degenerate. The immunity begins to get low as we grow old. So those are one of the things, this is one of the things that contributes to what? Disease process. Then what are the risk factors for disease? Is actually like the previous slides too, not like the same thing. Genetic, like I've explained. Is there a genetic? Is there any alteration in the gene? Then genetic is maybe there is a disease that is running in the family. Maybe it is hereditary. Let's say for instance hypertension, DM, sickle cell disease. No, they are all hereditary. Then the second one is age. As we age, our immunity what? Our immunity depletes. The ability to fight the ability to fight infection begins to drop as we age. So we have less tendency to fight infection. Then what about lifestyles? Some people are used to smoking, drinking alcohol in excess. Some are used to having multiple sexual partners. So all these matters, some people go through stress, the kind of job some people do prones them to a lot of disease. Like I've said, stress is another thing that makes us to be what? That makes us to be at risk for diseases. Then environmental factors, our weather sometimes, the weather will be too harsh. Take for instance during the harmattan, people are prone to having catarrh, all this upper respiratory tract infection. Then microorganisms like bacteria, viruses and fungi. We cannot rule them out when it comes to what? Risk factors for disease. And what about pre-existing conditions? Pre-existing condition, maybe okay, you have an underlying infection before. You have an underlying issue, maybe your immunity is already low, have been really stressed, then suddenly you are now exposed to a disease condition. You know that the body immunity will automatically it will be affected. You will not be able to fight infection. So these are the major these are the factors that contributes to diseases. So I want us to take note because of our CBT. Then lastly, let's talk about terms in pathology. I will not really dwell on these terms in pathology. So this time we have infection, pathogens, commensalism, we have symbiosis, parasitism, saprophytism, opportunistic infections, and nosocomial infection. So this time we should be able to master it. We should be able to master it as nurses. Infection, we now know that okay, infection is the invasion of the body with microorganism. Infection is the invasion of the body with microorganism. What are pathogens? Pathogens are all these disease causative organisms like bacteria, viruses, and fungi. Then when we talk about commensalism, you can go through your what's it called? Your study sections, your study materials. All these things are there. And even if they are not there, we can go to YouTube, we can go to Google. That is why we are here to learn. We can go to YouTube to actually study to know the definition. Commensalism is just like a relationship between two organisms, but in which one is benefiting, the other one is neither benefiting or losing. The other one is not benefiting and is not being exposed to any form of injury. Then when we talk about parasitism, I've explained in like 3 previous slides. Like parasitism is like okay, the parasite is a relationship between two organisms in which one is benefiting while the other is being exposed to harm. Only one of the organism is benefiting, the other one is not benefiting but is being exposed to what? Injury. It is actually that parasite that is causing injury to its host. So the host is not benefiting. But when we talk about symbiosis. Okay, I think I've not spoken about symbiosis. Symbiosis, both the host and the parasites, they are all benefiting. Both of them are benefiting from each other. Then opportunistic infection. What are opportunistic infections? Opportunistic infections are just like infections that, okay, normally your body should be able to fight. Your body is in good condition, your body, you have a perfect immunity, you are eating good food, you are in good shape, you are in perfect shape. You know, there are a lot of disease conditions that, okay, something will just happen and before you know it, you are okay. You will not even use drug. You know, most of the time, sometimes we feel somehow, we not even use drug, and before you know it, you are okay. But when we talk about opportunistic infection, when the immunity is low, all the disease condition that normally when you are in good shape, you'll be able to fight, the body, because the body immunity is low, you find that, oh, these diseases are actually weighing you down. So they are known as opportunistic infection. Let's say, for instance, a patient with HIV, you know, their immunity is completely destroyed. The CD4 count cell is very low. It's helping us to fight infection. So before you know it, disease conditions, disease that are actually not supposed to cause for concern, start weighing them down because the body immunity is already low. So these are known as what? Opportunistic infection. The body can no longer fight them. So they begin to affect the patient. You see that, okay, you have to manage the patient palliatively, you have to manage the patient with a whole lot of infection. And lastly is nosocomial infection, which is also known as what? Hospital acquired infection. So please get used to all these terms. Get used to them. Know them at the tips of your finger. So thank you for listening. Thank you and have a lovely day. So this video is going to be uploaded on the LMS. Please listen to this video. And if you have any question, we'll chat on LMS. So I'll create a link for us to chat so that we can actually have an interactive section. You ask your question. So see you in the next study section.